I hope I don't go over time or under time. Didn't time it. Oh, are you starting?
Okay. Good evening, everyone. I'm just going to wait one more minute to allow for Zoom people to filter in and get settled. I guess I should do the typical turn off your cell phones. Please note that the exits are near you and behind you. The nearest exit might be behind you, things like that. So I will go ahead and open tonight. Good evening, everyone, and welcome to Wellness at Eastman. I'm Galen McCormick, and I'm the program manager for Eastman Performing Arts and Medicine. I want to welcome our audience here at Howard Hanson Hall at the Eastman School of Music in downtown Rochester. Really excited for the presentation we have tonight. But first I have to do my typical housekeeping before I forget it. If you would like to ask a question, not those of you here in the room, but those of you on Zoom, please use the chat, or sorry, the question and answer part, and I will relay those to Dr. Natvig when we get to a little bit later in the presentation. So Eastman Performing Arts Medicine is a collaboration between the Eastman School of Music and the University of Rochester Medical Center. I'm very proud to say that we have such great support in Dean Jamal Rossi, Dr. Mike Rotundo, and Dr. Mark Taubman. Before we begin, I just want to give a land acknowledgement that where the University of Rochester sits is the land of the Haudenosaunee and the Seneca clan in particular, and that we are grateful to the keepers of the Western Door. So tonight's presenter, Dr. Mary Natvig, you're such a unicorn, my friend. She holds all 3 degrees from the Eastman School of Music. She holds the PhD in musicology with a minor in music theory from the Eastman School right here. Her 2 main areas of research are the sacred music of the 15th century, and in particular, I hope I say this right, the music of Antoine Buñuel. Am I close?
Benoit.
Oh, no, Benoit, thank you. And music history pedagogy, a field that she helped to establish with her 2002 book, Teaching Music History, which has been cited as the start of a 21st century movement to legitimize pedagogy as a scholarly pursuit within the field of musicology. Her other research interests include women's gamelan, women in patronage, the music of Marilyn Shrude, and music as a social metaphor in the American progressive era. But we're not talking about pedagogy tonight. So she will explain this topic that we're talking about tonight, what her connection is, why she has come here to share this with us. And later in the presentation, we'll be joined by Dr. Dagmar Kaufman from the University Counseling Center. And I will let her introduce herself when we get to that point, and we'll share resources that are available to all of us here at the Eastman School. So Dr. Mary Natvig, would you please come up and share with us about mental health in music school? Thank you so much for being here.
Thank you so much, Galen. I'm really happy to be at my alma mater. I love Eastman. Very soft spot in my heart for Eastman. Just a caveat, when I'm speaking about mental health, I don't go with my title doctor because I'm a doctor of musicology and not a doctor in counseling or mental health. I am not a counselor, at least not yet. I can't diagnose, and I certainly wouldn't even attempt to treat a person at this time, although I am in a clinical mental health master's degree program. That will be my retirement career, but not yet. Okay, I'm addressing you this evening as a person intimately acquainted with being a music student with mental health issues. And yes, it was a long time ago. And I am also a faculty member, however, who has lived with mental health issues and who still has them, although they have fortunately been treated successfully for many years. My interest in musicians and mental health stems from very personal experiences, as well as my interactions with many music students over the years who struggle with these issues, particularly when I was BGSU's College of Musical Arts Assistant Dean, whose job was to work with students music students in particular having academic difficulties. More often than not, poor academic performance was exacerbated by students' mental health conditions. Because of my own experiences and those of my students, I become passionate about musicians and mental health and the unique issues that music students face, particularly when they are college students. So this talk is both for Eastman students and Eastman administrators and faculty. My first goal is to dispel the stigma of mental health concerns, and the second is to help facilitate, hold on just a second. My little mental health just. So this talk is for both Eastman students and Eastman administrators and faculty. The first goal is to dispel the stigma of mental health concerns. And the second goal is to help faculty, administrators, and students advise those who may be exhibiting signs of depression, anxiety, or any number of issues, large and small, that affect our quality of life. And I'm here to tell you that things can get better. I thought I'd begin with a brief self-disclosure, as sometimes self-disclosing leads to demystification and destigmatization of psychological difficulties. And I'll talk more about self-disclosure at the end of this talk. During my undergraduate years, majoring in violin performance, I went to 3 undergraduate schools: Northwestern. Then, after the first quarter, I moved back home to the University of Wisconsin-Milwaukee. And finally, I went to the Eastman School of Music. And of course, I saved the best for the last. The reason for these multiple transfers was undiagnosed depression. I bounced back home after being miserable and despondent at Northwestern. And when my private violin teacher at UWM, whom I had studied with since high school, got a job as head of the string department and professor of chamber music at Eastman, I took the chance and transferred once again, hoping desperately that having a friendly face would help me adjust. And by the way, his name was Abram Lofton. You can see his picture on the second floor. Most people chalked up my bouncing around to homesickness until the summer before I transferred to Eastman, when I was at the Aspen Summer Music Festival. And on the 4th day, I walked in front of a bus, and it was not accidental. Fortunately, I was pulled away by a violist. And I know the violinists are saying this can't be true because violists can't move that fast. But thankfully, this violist did. Although I left Aspen a few days later at the advice of our family physician, who, after a phone conversation, deemed me a suicide risk, I did transfer to Eastman that fall. Once again, my problems hit within a few days. But this time, with the help of my former teacher, now at Eastman, and my parents telling me if I went home, I had to get an apartment and support myself, I stuck it out. But suicide was always in the back of my mind for almost a whole year. Once I acclimated, I did get better. I graduated, and I chose Eastman for both my master's and my doctorate because I was terrified of having to go through the awful adjustment months and fighting back feelings of wanting to die. Fortunately, I had landed in an excellent music school. And by the way, I did visit the counseling center at the U of R, and I was told that my grades indicated I was functioning just fine and that I didn't need counseling. Times have changed, and counselors now are very aware that one can be high functioning and still benefit from counseling. And the great news is, when I was 35, I found a counselor who suggested that I see a psychiatrist for assessment and possible medication, which was when I was diagnosed with persistent depressive disorder called dysthymia and periods of MDD, major depressive disorder. I still take a very low dose of the medication, and I check in regularly with a counselor. Otherwise, my life has been a great joy. It's not been without the normal ups and downs of life, but it has been free from despair. So that's my story, and it's time to give back. And time to dismantle the stigma associated with depression, anxiety, and other mental health issues and normalize getting help. In the last 10 years or so, 2 major studies, and there have been more actually, have indicated that professional musicians have significantly higher rates of anxiety, depression, and other mental health issues than the general population. For example, a 2016 Norwegian study compared the presence of mental health problems among 1,600 full and part-time professional Norwegian musicians to the general workforce. Musicians reported experiencing over twice as much anxiety and depression as non-musicians. Another well-publicized study from the same year, conducted by Help Musicians UK, reported that working musicians are almost 3 times more likely than the general population to have depression and anxiety, or anxiety. Among the 2,200 or so respondents, all self-identified as professional musicians, 689 worked in classical genres, 298 in jazz, there were some in world music and others in folk, country, or various other genres of popular music. 71% of these respondents reported having panic attacks, or high levels of anxiety, and over 68% reported depression. Reasons included poor working conditions, which aligns with the stress of trying to make a living, working hours, exhaustion, lack of recognition, physical issues such as musculoskeletal problems, and among women, sexism, harassment, and work-family issues. And just over half reported that getting help was very difficult. When you pair these results with the figures on mental health problems affecting college and university students in general, not music majors, who cite anxiety and depression as the main issues of concern, we can assume that our college and conservatory music students may be significantly affected by depression or anxiety. The causes, among them, stress, debt, relationships, career anxieties, are similar to those that most students of their generation report. But David J. Sternbach, a professional musician, teacher, and psychotherapist who's worked with musicians for over 30 years, warns us to be particularly concerned about increasing levels of stress among college musicians. And for those of you who will be teaching young people, these observations also extended to high school and middle school students. Steinbach focuses primarily on performance anxiety, but his observations apply to any kind of stress that musicians might encounter. He also believes that while self-criticism is at the heart of being a good musician, self-criticism in excess is destructive. B. Janet Hibbs, a psychologist who focuses particularly on adolescents and college students, reflects on a related condition that she calls destructive perfectionism, which in particular affects gifted students who cannot tolerate not excelling. Music students typically fall into this category. And most of you, myself included, though a very long time ago, were above average or outstanding academic students in high school, as well as gifted musicians. At Eastman, you have encountered peer musicians who perform equally well or better than you do. And in your first year, Eastman students were inundated with new, often unfamiliar ways to engage in music. Music theory and music history, world music, master classes, class piano, and so forth. These are things you may not have studied in high school. You had to adjust to practicing in a very tiny room, possibly with your classmates, listening outside the door, playing in multiple ensembles, living away from home, adjusting to the Rochester weather, having a roommate, and now inundated with social media, as well as going through all sorts of new experiences. Music has suddenly become something very different from what it was in high school. And changing expectations amplify stress. And untreated stress can lead to mental health concerns. Stress can also lead to musculoskeletal conditions that contribute to feelings of anxiety over lost practice hours or regret at letting down parents, teachers, and peers. Faculty assume, as do many students themselves, that music students are prepared for such pressure and scrutiny. After all, most of us have been immersed in music from an early age, and we're used to balancing difficult schedules. But expectations at the university level, particularly at a place like Eastman, are exponential. The following statement is important. Dealing with stress or any kind of psychological problem in its early stages is crucial. Long-term, stress turns into burnout, which is a clinical term for the condition of emotional exhaustion, depersonalization, and lack of perceived personal accomplishment. And the World Health Organization has recently included burnout in its international classification of diseases. Studies point to significant symptoms of burnout among university music students, as well as high rates for music majors and non-music majors. Burnout, in turn, is associated with or can lead to numerous conditions, both medical and psychological. These are chronic fatigue, insomnia, concentration or attention impairment, chest pains, difficulty breathing, weakened immunity, frequent or long-lasting colds, flu, etc., loss of appetite, loss of weight, or in my case, unfortunately, it was gaining weight, thank you, anxiety, which may lead to panic attacks, lack of productivity and poor performance, and emotions such as anger, pessimism, apathy, hopelessness, irritability, and loss of enjoyment or isolation. Burnout is also associated with depression and anxiety, the two most common presentations at university counseling centers. And that's a whole lot of negative information. And here's the good news. Counseling helps. My university's counseling center at BGSU once told me that he thought music students didn't want to make time for counseling when they encountered stress and depression and anxiety. I looked him in the eye and I said, music students don't have time for counseling. Given their academic schedules, their rehearsals, their practice time. He was incredulous when I told him that music students practiced 2 to 4 or more hours a day, in addition to their ensemble rehearsals and classes. That doesn't make too much time. That doesn't make much time in our university's case to walk almost 3/4 of a mile to the counseling center, particularly when open hours are during ensemble rehearsals. That's the downside of being a music department or school, especially those that don't have embedded counselors. And Dagmar will be talking about the opportunities at Eastman. And I'm grateful that music schools are now starting to have embedded counselors. And honestly, that is my goal someday. The upside is that music departments or schools such as Eastman differ significantly from most university units in that students and faculty share a common passion that usually began at an early age. Faculty and students regularly engage in similar activities, practicing, attending recitals, rehearsals, etc. And they spend significant time under the same roof, day and evening. We all know that this is true here at Eastman, and it's also true at the College of Musical Arts at Bowling Green State University, where I teach, my home base. Consequently, music schools often function as an unusually large extended family, which actually could be for the better or the worse, but let's focus on the positives. According to Hibbs, when a child, for whatever reason, is hopeless or verging on hopelessness, families are incredibly important and vitally important in maintaining hope. Having emotional expressions of the family conveying warmth, support, unconditional support, non-judgments. She says these behaviors are the best medicines. Although those of us who spend our days in music schools are not officially family, faculty, administrators, and fellow students can help one another by providing an accepting and supportive attitude toward mental health issues and knowing how to direct others to get professional help. I know you've recently had a mental health fair here at Eastman, and for that, bravo. I want to reiterate that making faculty, administration, and students aware of mental health issues and to recognize distress, as well as the services available here or at the River campus, are important for everyone in this community. This and what to do in an emergency are important aspects of developing a healthy environment for healthy mental health. Everyone should also be aware that people who talk about wanting to die, who are feeling hopeless, are unusually withdrawn, or express being a burden to others, should be taken seriously. As is any behavior that differs from a person's usual manner. These may be signs of suicidal ideation. Other indications are acquiring a firearm, poison, or stockpiling prescribed drugs, which, by the way, was my technique. In case you want to know. Increased use of alcohol or drugs, preoccupation with death, giving away personal items, lack of sleep or excessive sleep, another one of my little secrets. Now the world knows. Feelings of anger or revenge, change in hygiene or dress, and risky behaviors, which actually I did engage in a little bit at Eastman when I was an RA, and I jumped from one dorm roof to the other dorm roof, but that was in order to see the 4th of July parade, and I wasn't impressed. Okay, more significant specific signs to Eastman would be change in practice habits. Is the person practicing way more than usual or far less than usual? Missing lessons, rehearsals, or a performance with no communication. Isolation. Withdrawal from meals or conversations. And actually, sometimes there are no symptoms. except those that manifest behind closed doors. If, as a friend or as a faculty member, you believe someone is in a mental health crisis, reach out or ask someone else to if you don't think you're able to, and then follow through on that. Listen non-judgmentally, offer emotional support and empathy, but also guard your own time and emotions. It's most important to encourage the person to get help and to provide information on how to do so. If possible, help them make an appointment or accompany them to the appointment or meet them afterwards for coffee if they are amenable but don't pry. But also be open to listening if they initiate information. Check in once in a while to see how they're doing, and in other words, be supportive. And also be responsible. People in a crisis situation need assurance and stability. Don't say you're going to meet them and then forget or decide not to go. If the person seems to be expressing suicidal thoughts, ask them directly. Are you thinking of killing yourself? Do you have a plan? And have you taken any steps toward that plan? The more planning, the more the person is at risk. Many people find these questions disturbing, difficult, counterintuitive, and also dangerously suggestive. However, often asking these questions can lance the boil, and people who are having thoughts of suicide may finally feel understood, relieved, and cared for. So talking about or asking about suicide does not encourage people to actually do the act or put the idea in someone's head. If a friend or a student, if you're a faculty member, indicates they are imminently considering suicide, take immediate action. Do not leave the person alone. Seek help. Take the person to the counseling center, the emergency room, call 911, or follow your campus policies. Remain calm, comforting, and empathetic. For those who have experienced mental health issues, and I'm speaking specifically to faculty or possibly graduate students, think about a concept called the pedagogy of self-disclosure, a technique I've employed when appropriate for many years. You heard my self-disclosure earlier in this talk. The self-disclosure theory was first defined in the early 1970s by psychologist Sidney M. Girard as a therapeutic technique between therapist and client. It can be applied, however, to any trusting relationship that seeks mutual self-knowledge and is now employed as an additional tool that increases student engagement and motivation in all sorts of fields. Janet M. Wright, whose topic is the self-disclosure of identity, states that when teachers are forthcoming about their own struggles, students can discover connections with themselves and penetrate barriers to understanding. My experience in self-disclosure has proven this to be true. I've never had a student, even if initially hesitant, decline to go to the counseling center after I have self-disclosed. Wright emphasizes that students need role models in order to break a sense of isolation, hopelessness, and fear. When students know they're not alone, they feel comforted and affirmed. Those who experience depression, anxiety, and other mental health issues, especially for the first time, find themselves in a body and mind that are not their own. Their psyche has been betrayed them, and they are living in a strange and unknown territory. This territory is bordered by shame and stigma. Many feel alone and hesitant to ask for help, and they might also believe that nothing can help. Destigmatizing depression, anxiety, and other conditions through self-disclosure, through telling one's story, can alleviate feelings of shame, assure students they are not alone, provide hope, and penetrate barriers to professional help. Thus, self-disclosure can provide a much-needed conduit between despair, failure, and health success for students suffering mental health problems. In 2008, one of the most persuasive arguments for self-disclosure, specifically regarding mental health, came from a report published by the Center for Mental Health Services, Substance Abuse and Mental Health Services Administration that investigated the literature of self-disclosure, primarily in the workplace, as well as among mental health providers, clergy, and politicians. Although not focused specifically on teacher-student relationships or peer-student relationships, The document reveals that self-disclosure conclusively destigmatizes mental health issues, provides hope, and leads others to seek professional help. Although the report maintains that self-disclosure can be difficult, contributors to the study found that it also benefited their own recoveries and helped them gain confidence. Jeffrey Bierman, who uses the pedagogy of self-disclosure in his university-level writing classes, cautions that there are risks in self-disclosure. Shame, rejection, misunderstanding, and ridicule, and that the more one discloses, the greater threat of shame. It's therefore important that those who are self-disclosing are mentally stable and able to speak confidently and compassionately, and most important, are able to articulate the importance of getting professional help. Mental health self-disclosure should serve others by facilitating their personal academic and musical success by encouraging them to seek help. Self-disclosure should be selective and strategic. It should cultivate responsibility, avoid personal glorification or self-pity, and steer clear of the contagion effect when emotions or moods are spread by suggestion or influence. So it's important that the person who self-discloses is emotionally healthy in order to discern the appropriate level of self-disclosure and to gauge the effect it's having on the student or on the friend. Self-disclosure is meant to help the other person. It should not be ego-driven. Before disclosing, some questions to ask are, will self-disclosure help this person feel accepted? Will it give them hope? Will it help their quality of life or their musical or academic performance? Will it help them to remove the stigma of mental health and help them to seek professional help? And I think that's my involvement in self-disclosure with students who've come to me with problems. I think that is the number one thing that I try to do, is to remove the stigma. And then you also have to ask yourself, are there risks to either yourself or to the other person? Finally, self-disclosure should not lead to amateur therapy. We are not therapists. I hope to be one someday, but I am not yet. Even if we'd had therapy ourselves or some training in counseling, self-disclosure is not time to focus on our own problems or impose our own solutions on anyone. Although there's nothing wrong with encouraging students or friends to get enough sleep, exercise well, eat well, that's all fine. We need to avoid discussions and advice that's best left to the therapist-client relationship. Recognizing these boundaries also protects us from those who might criticize the idea of self-disclosure, despite its proven efficacy. No one is obligated to self-disclose. Factors such as age, gender, rank, or comfort level, and stability within one's own mental health journey are all factors in the decision to self-disclose. If a person is not comfortable self-disclosing, perhaps there's someone more able to do so, or another way to help the person. For all who do self-disclose, it's important to have a support system in place, and also to remember that the person's identity and situation that you're self-disclosing to needs to be absolutely confidential. The act of self-disclosure, comes with long-term responsibilities and accountability. Once one has self-disclosed, you can't take it back. And I just self-disclosed to you, so there's no taking it back. People will want your support and your input. Those of us who self-disclose must, however, guard our own health and time and be vigilant about our role. Again, we're not therapists. Unrealistic expectations can be dealt with kindness, and especially with referral to professionals. The main job of a person who self-discloses is to listen, to be supportive, to alleviate shame or feelings of alienation, and to motivate others to get help. We may need to reassure the person that taking time off is okay, or that they can still love music and participate in music without being a music major, if that is in play, and that life doesn't go in a straight line. What we planned may not be how things turn out, and yet what turns out might be even better. We need to be authentic and genuine. We need to care for others as we care for ourselves. My own journey, which included a deep passion for music and began at a very early age, coupled with difficult, confusing, and nearly debilitating mental health issues that were eventually treated and alleviated, has given me the courage and desire to reach out to others. I believe that, quote, From everyone to whom much has been given, much will be required, unquote. And I have been given much. That is why I self-disclose. Finally, self-disclosure is not the only way to help our friends, students, or colleagues. Regardless of our own experiences, we can educate ourselves to help destigmatize mental health issues, and we can be sensitive to those who are showing signs of distress. We can encourage mental health awareness. Our most important task is to offer unconditional love, a supportive, caring environment, encouragement, hope, the alleviation of stigma, and encouragement to seek professional help. These are tasks that apply to our friends and also to ourselves. Thank you.
So much, Dr. Natvig. I really appreciate you bringing your personal story in and weaving into how we can help others. And one thing you said, I just want to remark on right now, how we should care for others, that we would care for ourselves. And sometimes I think we can even flip that. Often I see people who are caring for others and not caring for themselves. So I want to invite my colleague, Dagmar Kaufman, to come on up. Thank you for joining us tonight. Here-ish, they'll see you on the Zoom call.
Okay.
And if you don't mind just telling us your role here at the university, that would be great.
Sure. My name is Dagmar Kaufman. I'm a clinical psychologist. I've been working with the University of Rochester University Counseling Center for training and in a professional role close to 2 decades. And one of my favorite connections in that role has been a special connection and liaison relationship with Eastman and the Eastman students. We have a satellite office here, which is, I think, what you refer to as embedded counseling, which basically means giving students access to the counseling and treatment kind of closer to where they are, and in general, decreasing some of the barriers, especially for busy music students. We don't have just one person here. We kind of rotate through. I usually am joined by at least 3 colleagues who come on different days of the week. So that, you know, if you don't want to see me, or you prefer to work with a man, or you prefer to work with, let's say, a counselor of color. If we have somebody connected to Eastman that particular year, you have some options. And we now, in age of the pandemic, have a lot more options because we can also do therapy via Zoom and do a lot of it right now, although I think we will be returning more and more, hopefully, to in-person treatment, because there's something about sitting in a room with somebody and listening to their story and then helping them hopefully make sense of the pieces that that are missing or that need to change, and help them have access to that. And so as a student at the University of Rochester or at the Eastman School of Music, usually services with the University Counseling Center, as well as the health center, are paid for already by a mandatory health fee that all students pay. Our services are confidential. There's no additional fee associated with them. So hopefully that is another barrier that is removed from seeking therapy outside of the university setting. It's arranged as simple as making a phone call, although I also realize that that is becoming less simple for some college students who are much more used to making appointments online. And so we're working on at least having the initial appointment scheduled online and coming up with a system for that works. That's probably not this year, but hopefully coming next academic year. But we also have, in addition to individual counseling, we have a lot of other resources and treatment options available. We do a lot of group therapy, and we also do in the last year or two have been doing a lot of Zoom drop-in groups that require less kind of upfront signing up or planning, and usually have particular topic areas. Group therapy can be a wonderful tool to connect with others in a meaningful way and learn about yourself and the relationships that you have, yourself in relationships, and how maybe to do some things that are new or different. We all come from our families with particular patterns of interacting with others, and sometimes we get into a different environment and they don't really work as well as they did before. And so group therapy is a great tool for that, and for I think some of what you tried to also speak to, the sense of we're not alone struggling. There are many students both at Eastman and on River campus who struggle with mental health issues, and at the same time can be highly successful students. And so I'm really sorry about the experience you had a long time ago. I also really appreciate the courage that and the need that there is for us to speak up, to tell our own stories, especially in positions where students might look to us and say, okay, this person has had their mental health concerns, has gone through treatment, and they're leading a rich and good life. And that gives people hope and gives us a lot more street cred, I think, when we talk about therapy as well. I wanted to talk about a couple of other things that are available. Medication services, both our UHS primary care staff, as well as our psychiatry staff, do a lot of consultation regarding mental health related medications, what they do, what they don't do, how to best use them, when to best start them. And so I would encourage students, and I do encourage students, sometimes they come through the primary care side, sometimes they come through the counseling center side, but to be as informed about the options that are out there for them, and to make good decisions for themselves. The other pieces that are available are a lot of consultation, outreaches, and programming like this, but also consultation to individual students, staff, and faculty. When there's a concern about a student and maybe some question about how to best approach this, what are some of the resources that I can point that student to? It's always okay to call the UCC and say, I need to talk to somebody and kind of formulate a plan, or get an opinion, a professional take on the situation. We do a lot of those. We also have a staff member on call 24/7, rotating for emergencies. So really there isn't any time, even when the office is closed, when a professional from the UCC is not available. The other service that we recently kind of folded into the what we have available is we contracted with an agency that provides short-term counseling, solution-focused counseling via telehealth all over the world. And they have a program that's specifically focused on participating universities and college campuses. It's called MySSP. I think it stands for Student Support Program. It's an app, and there are two pieces that feel important to mention. One is that, kind of similar to our on-call service that's available 24/7, that doesn't require anybody having had any prior contact with the counseling center. If somebody wanted to contact MySSP through their, download the app and contact them, what they have available is both phone chatting as well as text messaging, which some of our students have always wanted us to do, and within our center don't have a big enough staff to also then provide text counseling via text, but that's available. It's usually, this is a kind of one time people are in distress and they can have a conversation via text. If a student contacts my SSP multiple times with this one-time fashion, they might get different therapists that they talk to. Probably at that point, somebody will suggest might be useful either to go to the University Counseling Center to seek some regular help, or my SSP has another, this kind of second leg is that they have also ongoing therapy, and it's brief therapy, which is also what we provide at UCC. It's usually via phone call or video call. One of the really cool things is that there are many, many languages available. There are not the kind of licensing restrictions that we deal with. Most of our therapists are only licensed to provide therapy in New York State. The whole system is quite complicated across the US, and then certainly once we cross national boundaries, and we only have so many languages available, although, you know, diversity and being able to meet our clients where they're at, both language-wise, culture, in terms of cultural competence, all of those things are important at UCC as well. However, there are some things that we can't do, and it's really nice to have this added service to meet students. It could be something for students studying abroad or going abroad for a while, or going home for the summer, being at festivals in the summer. So I'm really glad that there's some way we can further wrap around. I'm talking for a long time. I don't know if there's
It's very
anything.
helpful. I can't get the Q&A on my device, so I'm just gonna peek here. This is very, very helpful, Dagmar, because as you know, on our campus, there's tends to be misinformation that lives much longer than the true information.
Yep.
So I'm really grateful for you just articulating the many, many layers of service, the many ways that we can access. I was thrilled when my SSP rolled out recently because of this being a much quicker way for some people. I know it's maybe not the preferred way long term, but as you said, meeting people where they are is really important. Pardon me for a second.
Yep,
Check here.
absolutely. Yeah, I think, you know, however people get in the door, that's the good. The more ways we can have, the better.
Exactly, exactly. You just have some compliments in the chat, both of you, from some of the people watching tonight. I don't see questions there right now, but I want to thank all of you for joining us here. Thank you, Dagmar. Thank you, Mary. It is just, it's really wonderful to address this topic that I think we all know is an issue in music careers and music schools. And I'm so grateful that the University Counseling Service has given Dagmar, you know, that you are particularly assigned to the Eastman campus. So we have this relationship with you, and that you really do understand our campus so well, especially, may I say, mom of a music student, blossoming into a music student now soon. So you do definitely understand the stresses and struggles that we go through. So thank you, all of you who are here. Thank you to those of you who joined us on Zoom. Just want to give a shout out to a program that's coming up that's on meditation, a slight sidestep from our topic tonight, that's on this campus. It'll be on Zoom, and it's being led by Professor Melina Essa, starting this Friday at 3 o'clock. Everyone is welcome to this. You have to register. You can find that online and in our newsletters. And please join us next month in April. On April 13th, we have our final presentation in this series, and it is on vocal health and hygiene. And I've invited my colleagues from the Voice Clinic, that's Leanne Grasso and Dr. Todd Schneider, to come in. And I thought this would be good timing right before juries to talk about how not to blow your voice out right before that big moment in our spring semester. So to all of you, please take good care, and I'll see you next month. Thank you so much.